Lack of access to primary healthcare, screening, and appropriate facilities remain a main driver of the shocking death toll in sub-Saharan Africa. The solution? Technology, innovative models leveraging community healthcare workers, and mobile clinics. Maternal health, they usually have one dedicated day in a week where all antenatal and maternal health services are offered. And because of that, you're finding out that thousands of patients are queuing up for that single day. So patients have to wake up at 6 in the morning, go to the hospital, queue up. Maybe they get served at 12. In Zambia, about 8 or so mothers die every day from preventable causes. If you compare with the global north, for example, in Finland, only about 3 mothers die per 100,000 births. Whereas if you compare to Zambia, that's about 270 deaths per 100,000 births. So the comparison is very significant in terms of how many mothers we are losing locally. So Dawa Health is focused on empowering last mile health workers to provide community-centric healthcare. So how that works, we have a digital health platform. So this incorporates AI into it. There's a Gen AI chatbot that mothers can get access of validated medical information. So what kind of contraception she can use, when she can use it, complications that can come from there as well. And on top of that, we have mobile clinic vans that are in the communities. So we go into the communities, mostly slums, in Lusaka at the moment, where we are able to park the van. Then patients are coming to the mobile clinic van to get comprehensive care. So there they can get sexual reproductive healthcare knowledge, they can get checked on STIs, they can get checked on their pregnancies and all that. So that's how it works. And additionally, we've incorporated a motorbike network that enable us to deliver things like birth kits in the communities and the contraceptions they need. So it's an end-to-end kind of platform that is using community healthcare workers, first-level clinicians, a digital health platform, and mobile clinics to provide end-to-end sexual and maternal health care in the slum communities where access is a challenge to date. Our core solution integrates a multilingual Gen AI bot, allowing women to ask confidential questions around cervical cancer and screening options. This model directly addresses the existing barriers like privacy concerns, screening fears, and stigma. A woman who then tests positive is then directed to one of the 8 partner slum clinics located across Lusaka. At this clinic, the midwives performs an AI-augmented screening using the MedSiglip fine-tuned model.
Dawa Health has enabled us to increase the scope of services because legally speaking, a pharmacy is limited to what services it can provide to the community despite having a capacity to provide them to the community. And so what Dawa Health has done is it has brought its mobile hospital that expands the scope of services that it can provide, because it gives us an opportunity to have medical doctors, the nurses, the pharmacists being in one place, giving the services that the community wants at a go.
But how does this work in action? Well, we were invited by Tafadzwa and his team to join them at one of their pop-up clinics to find out just how accessible Dawa Health is making healthcare for expecting mothers.
We've arrived in Bauleni, which is one of the largest informal settlements in Lusaka. As you can see, Dawa Health have already set up one of their mobile clinics behind me with Magen pharmacies. There is already a long queue of women expecting mothers that have come here to get their tests done today. So we're going to go see how the process works and meet Charity, who does all the testing for the ladies.
Once an expecting mom walks in, first of all, would love to know whether they've already started their antenatal care. We do our routine checkups. Apart from being pregnant, we want to see whether there are any medical conditions as well.
And then once they've done their triage, they get sent through to the van?
Yes, once the triage is done, they're sent through to the van where we do all those, like the checkups.
What kind of checks are you looking for when you have them in the van here?
We want to see the abdomen. We want to see the height of fantasy. We want to see whether it's descended. We want to see the lie of the baby, the position. The results are within maybe 5, mostly that's like the maximum 5 minutes.
Wow.
Yes.
Only in 5 minutes?
Yes, yes.
Dawa Health goes beyond pop-up clinics. They've developed an app that gives pregnant women easy access to services like home visits and delivery kits right at their fingertips.
So I was actually scrolling on Facebook when I found the Dawa Facebook page. It was advertising the delivery kit. There were surgical blades, gloves, maternity pads, jig, the one they used to clean after giving birth. There were some delivery sheets. Yes. I had checked my blood levels and I was told it was okay. I would be able to deliver safely. Because without me knowing that, I wouldn't have known until the last day, where they would have told me, no, you need to boost your blood for you to give birth. And you find that it would have been too late. Yes, I've actually been telling like the people around me, no, these health facilities, at least they come home, they come to do their home checkups, which is easy. You find that someone is heavily pregnant, instead of them going to get the checkup at the clinic, for them to walk the distances, at least they have to come home. They come home to do the checkups, yes.
Ma, apa manje tuzangire sakansimbyaka kakuti tione.
Okay.
Mulomo wa chibaliro.
Okay.
Chukwa ndiye pamipa peseka kansa.
Oh.
So tizakile nako muzamvira chie kuzizira pangono.
Oh.
They have a sponge holding faucet with cotton on it. They have the gel and a small cotton. Thank you. Pochosa, tanzania kako ka discomfort kangono.
Okay.
Based on the stage classification, the system advises the midwife on the best course of treatment, adhering to both the University Teaching Hospital, Obs and Gyn, and WHO guidelines.
Apa nukina ni chabe? Procedure eve yasira.
Okay, so.
Munga okay.
Good day. I am Kainsile Makakula from the Kingdom of Eswatini, and I am a machine learning engineer. My expertise lies in computer vision. So in this project, what I did was to train and to test a computer vision model in which we achieved 18% zero-shot accuracy. And after fine-tuning it, we went up to 90%. So what I learned was how iterative experimentation can unlock big performance gains. And the challenge that I had to face was having to learn about med sick leave, because it was my first time applying it, and also having to deal with limited data. So what I'm excited about is the application of artificial intelligence in cervical cancer, since it is what actually causes a lot of deaths where I come from. Eswatini happens to be leading when it comes to cervical cancer cases, and I hope this project, this model, is going to help mitigate that. Thank you.
My name is Kudzai Mwedzi. I'm a data scientist based in South Africa. During this project, I was responsible for creating the data set for the cervical cancer classification. I had to convert the data into JSON-L format, which is compatible with MedSiglib model that we were going to use. I also had to check for class imbalances, run a zero-shot classification to check if our model was pre-trained with colposcopy images. Then after that, I can say during this project, it was an honor working with a brilliant and multidisciplinary team that consisted of a software engineer, a medical doctor, and a machine learning engineer. So altogether, it was quite an amazing journey. Although there were a few hiccups, one that I can highlight is the use of Vertex AI, which is a very sophisticated and daunting environment consisting of so many features. but that was a phase that we overcame. So all in all, I can say I'm very excited about this project because the fact that after fine-tuning, our model achieved 96% accuracy, it is something that we can be proud of. And I can say I learned a lot that good data leads to good data models, and this is something that we are really, really proud of.
Hello, my name is Tara Faith Munzwa. I'm a software engineer by profession. My role in this particular project is that I developed the front end for our system. I developed 2 WhatsApp user chatbots, one which is being powered just by Gemini and the other one by Gemini and MedSignal. The challenge I would say at first is that I figured that the Gemini model was deteriorating its performance the more the information I added. This forced me to separate the WhatsApp chatbot for the everyday user, the woman, and for our clinicians. The other challenge I noticed is that Gemini kept on code switching between languages throughout the user's conversation. When a user was using, let's say a user had created this chatbot in English, meaning that the user wanted to interact with the bot in English, but then during registration, the user did enter a name, a name which is not an English name. So when a user enters their name, let's say it's a Tonga name or a Ndebele name, the Gemini model is then using this name to detect the language and then code switches the name and tries to re-register this particular user using the language detected. What excites me most about this project is that we are empowering women to take charge of their health privately and conveniently.
This innovation is not a nice-to-have technology. At scale, it can save thousands of lives every year across sub-Saharan Africa. In partnership with the Clinton Health Access Initiative, the team is now moving to further fine-tune the model using a massive 33,000 sample local dataset developed with patient data from institutions like the University Teaching Hospital.
Received a lot of requests to say why is the bus, they call it the bus, the mobile hospital, not coming every weekend.
Actually, the World Health Organization essentially ideally wants maternal mortality rate across the world to be under 100,000 births, and in Zambia we still have them close to 250. So we are hoping we can get there to as close as 0 as possible, right? Like I mentioned, about 8 mothers will die daily from preventable causes in Zambia, and with our work we now have some of the predictive technology and the decentralized care. We hope we can bring it as close to 0 as possible.